Thank you very much. We are about to start our presentation. Our topic is centered on the contemporary forms of exploitation faced by street-connected children in the hostile economic environment of Zimbabwe. That is our topic. And you can see that from the topic itself, our main attention is focused on the forms of exploitation. And there are different forms of exploitation as we can know, but we want to focus on the exploitation which are centered on the hostility of our own economy in Zimbabwe. Right? On the introduction, the Zimbabwe economic situation, actually, it is in a sorry state due to various factors which span from the high degree of corruption, the so-called economic sanctions by the politicians, the political impasse, and the inconsistency of the policies within our governance system in Zimbabwe. So these factors have resulted in the destruction of the social service provisions in our own country, in our own land here in Zimbabwe, which has led the street-connected children to be the most casualties because of economic growth, because of the way how the economy runs, which means that the street-connected children are in a poverty-stricken situation, and they are connected in the street due to various factors which are centered on the needs and wants for survival. Right? Meaning to say, we are trying to say the situation in Zimbabwe, especially when it comes to children, they are found in the streets, especially in the CBD, Central Business Center, as well as in the locations. They are found in the streets. Why? They are looking for needs and wants for their survival. They are being pushed into the streets because of poverty. So the economic situation in Zimbabwe is so hostile in such a way that it is difficult to have a decent living, especially to the vulnerable children. With that, this will take us to a point that the current food poverty line, which is FPL, is at $33 per person in Zimbabwe, according to the Zim stats of 2023, which is now that $33, but the people of Zimbabwe, they are surviving at $1 per person. Yet the FPL was supposed to be at $30 per person. Here in Zimbabwe, the current that we use is we use the US dollar, the 33 US dollar, but individuals that are surviving at $1, less than $1. So this is justifying the level of poverty that we are facing, which has pushed the children to connect each other in the streets, and that it will justify how our economy is so hostile. Okay? So the main objective of this research was centered on to explore the contemporary forms of exploitation. When we are saying the current forms of exploitation, which are being exhibited by street-connected children in Zimbabwe. That is our main objective. That's our objective. So, child exploitation is a form of child abuse. The hostile economic environment has exhibited street-connected children to fall prey into all forms of contemporary exploitation, such as slavery, drug abuse, human trafficking, violence, criminal activities, joining criminal gangsters, sexual exploitation, as well as begging. That is according to Gabriel 2021. Right? We also need to find out the prevalence of street-connected children globally. According to the UN 2023, there are almost about 150 million children who live on the streets. In Africa, we found out that according to the current research, it is over 35 million children. They live on the streets, and more than 80% of the African population, they live below the poverty line. And in Zimbabwe, the situation is worse because we are in a sorry state because of our own economy. We are more than 80%. The rate of the street-connected children in Zimbabwe, there are no actual statistics to indicate the extent of street-connected children. Why? Because almost over 90% of the children that are found in the street, which has been worsened by the COVID-19 situation, which has crippled all the economic gains, all the economic activities, both to their parents, to their guidance. The economy has been crippled by the COVID-19. So we don't have, but however, there are efforts from other researches which have indicated that maybe according to Manungo and before the COVID-19, there was some sort of a research which had been taken by Manungo, which argued that in the streets of Harare, we are focusing on the streets of Harare. 62% of the children they slept in the streets, while 38% both they are found on the streets, and some of them they are found at home. But this actually takes up that 38% they are found because of poverty. They are on the streets as well as they are at home. Right? We also need when you are to the background of this research. So my colleague Loreen is going to take us and to explain the background, the situation here in Zimbabwe. So over to you, Loreen.
Okay, so our research background is like Zimbabwe as a country is mainly based on the agro-economics way of living and mineral-based. So Zimbabwe, we have large reserves of diamonds, platinum, and also gold, lithium, and other minerals yet to be discovered. Since we are in Africa, we believe we've got many minerals here. So despite having such powerful resources, the economy is run by informal sectors such as free market and black markets. So the way things are done here, the trade way of doing business is not the formal way. It's more like a black market situation. I think most of us, we can relate with the Zimbabwe Economic Al Jazeera document of the gold mafia. That's how the economic situation in Zimbabwe is like currently, according to these news reports. So we have most of the hustling activities, which also justify the economic hostility, where there is no proper equation for surviving for most of Zimbabweans. So when you talk about our hustling, it's more characterized by the illegal activities. So there is much criminality in the way of doing things, which also constitute the human abuse way of finding the surviving means in this economy. So according to UN, when you talk about the child, when we say street children, we are also looking at these children below the age of 18, which is also at par with the Zimbabwe Constitution of 2023. So street-connected children are vulnerable of the vulnerability, which we are saying they are worse off because the most of Zimbabwe are in the vulnerable situation. So when you talk about the street children in Zimbabwe, they are more worse off in the situation. So these are children with able-bodied and also those with disability. You find them within the street. The Zimbabwe GP is mostly, like currently estimated at 36 USD million according to World Economy. So what really led to these street connection children, or factors which led to street connected children? So we've got many push factors such as poverty, which Prince highlighted, and we also have the great link between the street connected behavior and daily economic demands. So it's more like other children who are also coming from the better way of living. They are also kind of admire the way other street children do things in the street, and they are more moved to that way of doing things. So it's more like some of the causal factors for the children to be in the street. It's like they run away from the homes and they want to be in the street because they view the street life as a way of doing things, but they'll be begging. There is no control from any adults. So for them, if they be able to be at the road and beg for the dollar or any drink or any food for those motorists, they see it as a way of getting things easily. And they also have the pull factors, which is peer pressure. If my friend at school is in the street, like, so the current situation here in Zimbabwe is like you'll find children begging in their school uniforms. So it's like when you are in the CBD of Harare, the way the education is like, it's more of hot sitting. Some will go in the morning, then some will go in the afternoon. So they will come in the street if they just know that I have to be at school in the afternoon. They'll come in the street in their uniforms and they beg. Then when it's time to go to school, they go to school. So it's more like how it is done. So it's like every child is more poor to be in the street because they're trying to make things work. It's like helping their parents out. Sometimes the parents say, I don't have any stationery for you at school. Go and beg on the street. So there's like, if I be in the street and get $1, I'll go and buy a pen and a book and I'll be able to go to school. So that's how it is here in Zimbabwe. So we've got different forms of child exploitation. So according to Bedfordshire University, they demonstrated the interconnected nature of all forms of child exploitation. So we have sexual exploitation, criminal exploitation, serious youth violence, bullying, social isolation, and the radicalization involved in terrorism. So the sexual exploitation is like, we'll find a lot of underage, mostly girl child, seeking help at our local government clinic because they have maybe STIs, advanced stages, or someone actually just see them, mostly maybe social workers, and they said, you know what, or okay. Just an example on this sexual exploitation, and let me move on, I think, because of time. Then let me leave this to Prince to present on the methodology.
Okay. In carrying out this research, our research paper was, we used the mixed research approach as well as the auto-ethnographic research design to explore the contemporary exploitative conceptions faced by children living on the streets of Harare. Meaning to say, our area of attention was the capital city of Harare, where there is a hive of activities. Then we have to generalize the findings to other cities. The researcher used the purposive because we're focusing on the children who are connected on the streets, as well as the snowball, because some of the children who are connected on the street, they are hard to find. And some of them, they've got some bases where they stay. They don't allow people to they do not allow people at their own residence, which they call their own residence. there are some segments, some certain segments on the streets which they don't allow people to see. Maybe we say those people who are taking out research. So we use the snowball assembly. Those who can, they can refer us, and we analyze our own data using the thematic content analysis. That is part and parcel of the methodology when we are carrying out our own research. Maybe there are. So in conducting this research, we are now on the key findings. The key findings are at par, some of them are at par with the Berkshire University, that is the sexual exploitation. Street-connected children are sexually abused through child prostitution, participation in acts of issues to do with LGBTI activities, which, according to the Constitution of Zimbabwe, here LGBTI is not allowed. It is illegal. But now, because everyone, most of the children, they need to survive, they are now participating in all these activities. And they are now exploited by those who are by the adults so that they can get some economic gains. The issue of child prostitution, the issue of joining other culturally and cultural activities, such as the maybe the LGBTI activities, which are referred as illegal here in Zimbabwe. So children, they are there to swap sexual behavior in exchange issue to do with survival skills such as gaining foods. So there is swapping food and sexual activities. So the other issue, the other key findings was centered on economic exploitation. On economic exploitation, you found out that there is a lot of begging, and the begging which is being found on the street, they are found at the intersections of the streets, at the traffic lights. They are also organized begging, where we said, where Loreen has indicated that some of the child connected, they are found wearing school uniforms, so that maybe they can get some sympathizing behaviors. Some individuals, they can sympathize with them. So the uniform is now being used as a trap to lure some gains from the streets. So that is part and parcel of the organized begging. And the organized begging is under the economic exploitation. And also the other finding was centered on human trafficking. Street-connected children are at target because of this, maybe the current situation, because of the diseases. Some, they are now using the human trafficking activities where they want to sell the internal organs such as the heart, the kidney. So they are children who are connected, they are seen as an object for economic gains, right? The other findings are centered on the cultural and religious exploitation. Street-connected children are used as objects of experiment by different religious cults. For example, we do have a case of a street who was arrested after killing their fellow colleagues, their fellow street-connected children. This is an example of Tando Wengos, who used to kill other street kids and boil and bride women body parts on open fire for food. And it is this case is still in courts. And this case has taken us that to issues to do with mental health. Some are arguing, saying that Tando Wengos There's some mental illness. And that element of eating an individual is a destruction of moral fiber, and it is against the Afrocentric principle of Ubuntu, when we say, I am, therefore we are. An individual, the African Ubuntu is a collective system, where we say an individual is an individual because of others. Then the other exploitative method, the contemporary exploitative, it is centered on the politically exploitation, where we are now saying they found out that street-connected children are being exploited by the politicians. They are being given drugs for political cause. The politicians, they are taking maybe they want to demonstrate, they want to demonstrate, they give the children in the streets some form of drugs, some form of incentives, so that they put them ahead at the front for their own political gains. The other one is centered on the cyber harassment, which is the use of information technologies, ICT, to harm the well-being of children in the streets. Some of them that are being taken photos without the consent, and the photos are now being abused, are used to expose the humanity of the street-connected children. They are producing indecent images of themselves and engaging in sexual acts, chat online, so that they are doing this so that they can get something for survival, right? So in this case, technology plays an important role in exacerbating the effect of exploiting street-connected children. So the use of cell phones and other technological devices, yes, objectifying maybe the girls who are found in the streets, they are making girls who are found in the streets more vulnerable. Maybe at this point in time, we can say now we do found a lot of exploitative issues, such as there's lack of healthcare services. Some of these street-connected children, they are suffering from medieval diseases such as cholera, and they're currently in Zimbabwe. To those who are checking on the social media, we are suffering from the Zimbabwe in a certain state because of cholera. Most of the cities, most of the situations, most of the environment, people are suffering from cholera. So we can now say the street-connected children, they are much more prone to cholera issues, to do with the disease of cholera. So the other one, we also found out, our research found out that there is peer-on-peer exploitation, where the street-connected children, they are bullying each other. They are bullying why? They are bullying each other because of they are fighting for food. They are fighting for the gains, for survival gains. They are fighting for needs and wants. The research also found out that these street-connected children, they are exposed to diseases such as HIV and AIDS. They are exposed to STI, sexually transmitted diseases. They are also exposed to COVID-related diseases, because some of them, they are found on the streets where they are exposed to flu type of diseases, right? They are also exposed to poor sanitation and related diseases. They are also exposed to malaria, diseases such as malaria. And lastly, they are all these diseases. They are psychologically exploited. They are not, they is to do with mental health. The mental health challenges. For example, the issue of the case of Tanduengos has created depression among other street-connected children, as well as depression and anxiety. Right? At this point in time, my colleague is also going to conclude and give the recommendations. Over to you, Loreen.
Okay, on our conclusion, we have concluded that living and working in the street is a tantamount to failed social services. And this will ultimately taint community development. So street-connected children are psychologically, physically, culturally, socially, and spiritually vulnerable as they are exposed to unreliable access to food, lack of education, and medical care. So we are saying homeless children are often recruited for economic gains by exploiters, which Prince mentioned earlier. So street-connected child exploitation is a complex task that requires a proactive, multi-agent, holistic approach. Understanding exploitation drivers, teams, risks, venues of concern will provide the key prevention opportunities to stop children becoming victims of exploitation. So our recommendation is all based on funds. We can say that UNICEF, they can actually help by mobilizing resources to build rehabilitation hubs where children could connect and learn moral surviving skills. And maybe our laws to put stiff sanctions to anyone caught abusing these children, vulnerable children. Then we can also look on the life skills development where we say after the put of stiff sanctions on those who are caught abusing children, we can also maybe help volunteers. We can teach these children about life skills development, because they sometimes what really leads these children to street is because they lack the life skills on how to survive. They are not empowered on that. Then they also mental health help. We could also say those who are mental health practitioners could also maybe collaborate with other mental health providers to help these children have professional help in terms of counseling and also spiritual counseling, because we say Zimbabwe, we are a Christian community. Thank you so much for listening. This is the end of our presentation. Over to you, Brian.
All right. Thank you very much. Does anyone have any questions? Would you like to take some questions?
I have a question. Can you hear me?
Yes, we can hear you.
This is Jean. Thank you very, very much for this startling presentation. It seems pretty overwhelming. The organization of the children together to try to help, but at the same time, because they're so immature, they tend to, like you said, exploit each other. It seems like that might be one area of intervention by, we instead of trying to help one individual, it's really good when you can gather a group together. So I was just thinking about that. What are your thoughts about that? They're little street organizations.
Okay, so we were saying that if we could have the willing volunteers, we can actually fund, but we are not saying we are going to select individually street kids from the street. It's like a group, maybe based on age, because they vary in terms of age. So yeah, the group intervention, it's okay. We think it's a good thing, but sometimes age and sex can also become the factors which limit the expansion of the group.
That's very true. Even in some of our schools here in the United States, I'm in Southern California, and I'm very lucky, but we divide up even the kindergartners, first and second, in one group from the others, because the others are even though they're well off, they can also be exploitive of the youngsters. You're absolutely right.
Okay. Thank you, Jean.
Any other question?
Any other questions? Was that Megan? Did someone have a hand? Just go ahead and
Yeah.
speak. Thanks.
Can you hear me?
Yes.
Okay. So I came to the meeting a little later. I'm on the wrong time. I thought it was Eastern Standard, but yeah. So one of the things that I was hearing, like from the tail end, were some of the different issues that are plaguing the hostile exploitation, rather, that's going on a large scale. One of the things that I would just kind of probably went over this, but I'm not sure. When it comes to decision making, whether it's shared decision making by individuals from your organization, or if it's the decision making of young people, where, as we can see, there's some risk-related behavior, whether the risk can be denotated as negative, is, I guess, where we're kind of trying to discuss. But my question is, what is the outstanding kind of response to trying to develop decision making in individuals to gain their footing and their ability to prioritize, okay, once I have power over my decisions, even with the limited access we have, or it's based on that peer kind of fundamentalist model. If that makes sense.
Okay. When it comes to giving them the platform to make decisions on what do they really want, depending on their situation. So maybe because we are an African country, the way kind of when we view these kids, we say they should listen to their elders, but forgetting that they also have a say pertaining their situation when it comes to decision making. So maybe Zimbabwe being an African country, it has that, mostly I can say there's no room for the children to make decisions. Adults make decisions for them, which is maybe the area we should actually look at, because the moment we make decisions for them, they have these resistant behavior, and they can be, even if you put them in a rehabilitation center, they run away because they are forced to do what they don't agree with. So I'm just thinking that that's where they should be actually allowed to have decisions, or what can we do, the platform to say what's the way forward together. We want to help each other in this situation. I think maybe Prince wants to add something.
Okay. Thank you, Daniels, for the question. In terms of decision making, we do have a perspective, maybe the two-way perspective, the dual-way perspective of making decisions. We can focus on the decision on the part of the children. Then we can also take the root of the decision of those who are the have and the have-nots. The decision of the policymakers. In terms of the children now, we are now saying their decision is being precipitated, is being forced, is being pushed by the needs and wants. They are making decisions because of hunger. They are on the streets because they are looking for food. That is the correct decision. If they don't take such a decision, they are going to die because of poverty now. Now the other element of decision is centered now when their guidance and their parents now. They can decide to take them from the streets But because of poverty, they are now exploiting their own children so that they can gain something, they can gain food, they can earn a living from the children themselves. So the decision now, the decision-making process now is because they are vulnerable. You know, someone who is vulnerable, it is difficult for him or for her to make a decision, a proper decision. Yes, there's some laws, but the laws, they are because of informal activities which are on the streets. The hostility aspect of our topic now, of the Zimbabwe economy, yes, indicated that everyone here in Zimbabwe is now hustling. So the decision is centered on hustling. When we are now saying hustling is precipitated by criminality. When we are saying hustling, the definition of hustling is in Zimbabwe, in our own language, you say kia kia. There's no definition, there is no proper equation, there's no formal way of doing activities. So the decision aspect is imbalance. Thank you very much, Brendan.
Yes, if I can give you like a kind of like some validation with that. I was in the streets of Jamaica growing up, and in the garrisons, and involved in what we call like running boat. Like we didn't know where food was gonna come from, so each day we would, we try to like just hustle up food, or like we try to like do what we could do. And with those situations, there was usually a Don or somebody who had a lot of the power in the neighborhood, and we would try to sway him to get benefits or whatever was possible to kind of change our situation for maybe a small period of time, or whatever the case was. What I noticed was when we were able to create a through line between the lack of support for ourselves and with the state of affairs in the world, through somebody kind of showing us that there was more out there, that there was just like, okay, when you open your mind, that's why I went to decision making, because when faced with unsurmountable issues like we're talking about, we can't necessarily develop the big picture by ourselves. And with youth, they're kind of learning from the past generation, and then they're the generations that's going to teach the next generation. So when you have individuals learning from each other on a rehabilitation recovery model of just trying to make ends meet, there's a lot of misinformation on what is actually going to benefit them in the long run. So why I started the question with decision making is because when you're in a situation and you're being forced into it, then you feel like you're backed into a corner and you can't, respond. You can't act. You can't react. But when you get the opportunity to say, okay, even if I'm in a tough decision, I made that decision to be here. It gives you some perspective into, okay, I can facilitate my own growth. Because although like trauma is what we're talking about on different levels, there's also post-traumatic growth instead of only post-traumatic stress or post-traumatic devolving. So my opportunity to come to America was I had, kind of used up all my my tickets or my free reign in Jamaica. And I called a family member, and the Don in the neighborhood, seeing that not only did I have just, no real control over like my life, but that he knew that in order to gain some power over my life, that I had to start with who I was and what decisions I could make. And although I don't really respect all his motives, I think that mentorship is deeper than just what we do on paper. It's kind of like something in between that.
Okay. Thank you, Daniels, for the contribution. Thank you very much. Also consider it in terms of maybe helping those our children here in Zimbabwe who are on the streets, and some who are not in the streets, so that they can have a sort of to ensure their safety, as well as to mentor them, as well as to guide them and give them direction. Thank you very much for the contribution. Maybe Loreen might have something.
Nothing. Over to you, Brian.
Hi. Sorry, did someone else have another question, or?
I just wanted to ask about just one last question. I'm sorry. No, I'm not sorry, but the poverty in Zimbabwe must make this a bigger jump to overcome within your country. This is a big factor? Yes, right?
Yes, because we say the most workforce in Zimbabwe, which are the civil servants, they are least paid. So being least paid workforce, and also the bigger workforce, there is no employment in Zimbabwe currently. I think the unemployment rate is over 1,000, if I may say.
90%.
90%.
90%.
Yeah, 90%, I can say. So there are civil servants is a big workforce of Zimbabwe. They are least paid, and we are a multi-currency nation. We get your pay within our Zimbabwe dollar. We have to convert it to the US dollar on the street by these street children as well. So at the end of the day, it's like you have nothing. You're going to take less money at home, because their formal sector like supermarket, their prices are in USD, but you're not earning USD. So you have to go and convert your pay into illegally in the street, and you earn more way less money. So we're saying, yeah, the poverty is too much for everyone. Even those are formally employed, such as teachers, nurses, police forces. So for those who have got informal work, it's worse. So yeah, the poverty in Zimbabwe is getting worse by day, year by year. And we are, like we said in the background, research is due to do with political sanctions for Zimbabwe, and also the criminal activities from the officials. And so it's like the little are earning from these resources we have as Zimbabwe, and the majority are not getting anything. I'm not sure if you answered, Jean.
Yes, thank you. And thank you for all your hard work, focusing on the children when there's so much around you. That's the future, eh?
Yeah, thank you so much.
Thank you.
And we are 11 hours ahead, you guys. So I don't know if we're going to be here for long. It's like way past the 8 p.m. For us, it's more like sleep time. So I don't know if we're going to continue with you for long.
Thank you very much. This
Can I
is
question?
being recorded. Oh, sorry.
Could I ask a
Are
question?
you fine to take other questions?
I
Or
see that you have 16 different languages in Zimbabwe, 16 official languages. How do you
That's true.
organize different groups if they're different languages? That's first question. And I just want to add, Brandon, thank you for what you added in about finding meaning and finding strength, and no matter what situation you're in. So first question is, how do you organize with so many different languages? And second question is, do you have peer support programs in Zimbabwe? That's just two questions. Thank you.
Okay. Maybe I can answer and Prince can also add. Yes, since we have got many official languages, but we have this universal language, which is English, and which is being taught even at kindergarten. Every home, every parent is able to communicate in English because we are a former British colony. So it's like English is also the second language from Shona, which is the most spoken language. So yeah, when we try to have these different groups come together, we use English as a way of communicating, and then also putting the second language for that group. So yeah, communicating within these different languages is not a problem here in Zimbabwe, because I think everyone can able to speak English, not fluent English, but even the primary kids, because our curriculum is in a British way, curriculum way of doing things. So we use English mostly if you want to be able to reach other different languages. Then peer groups, yes, we have them through NGOs. We have different NGOs groups here, and also government. They try by all means to chip in, but yeah, the situation maybe is overwhelming for everyone, even the NGOs who try to come and help us to come here to have these peer support groups here in Zimbabwe. Jean, are you answered? Jean, are you answered?
That I think that question came from Anne, and
Yeah.
Anne, was
Yeah.
that, did you get your answer?
Yeah, yes, I got the answer. And yeah, and again, I just want to add in, thank you, Brandon, for bringing in those principles, peer support principles. And in the very difficult situations of world situations, it's interesting to think how these principles could help people find self-empowerment in impossible situations. I actually personally help resettle a couple hundred Bantu people in North America 30 years ago. And part of the problems I found are challenges is also the situation of women in societies where they were coming from. And can you talk about the empowerment of women? And I know we're at the end, but can you talk about the empowerment of women in your society as well? Thank you.
Over to you, Ms. Brian.
yeah, you can, if you're able to, you can answer the question. Are you on a time restraint? We have to wrap up in about 10, 15 minutes, but if you are able to continue, that's fine. Does that work,
Yeah.
Prince, Loreen? Or
I don't think we'll be able to continue because of the time factor here. Thank you so much for considering us to be the first presenters, because I think we're not able to present if you were giving us other slots, because it's almost
Almost sleep time.
sleep time, yeah.
okay. Thank you so much.